Hi, my name is Shaquaya Brown. Today we're going to be doing IV fluid and medication administration. We're going to start off with our hand hygiene. We're going to put on our gloves. We've gathered our supplies. We have alcohol swabs. We have our primary tubing set, a 15 macro drip. Inside the set, we have our spiked in, which is sterile, needs to always remain sterile. We have the chamber where we can view our fluid and count the drops that's going into the patient. We have the actual tubing. We have the connector in, and we have where we connect the adapter where we connect to the patient, and we have the piggyback where we can push medications as well as connect the piggyback fluid. We have our clamp. The clamp controls the rate of which it is given to the patient. We want to make sure it's closed, which it is. Down, up will make it open. So we're going to put that back inside. We have our secondary tubing as well. Our secondary tubing is a 15 macro drip set. We have our fluids. Our fluids is a 150 ml bag to be given over 1 hour at 15 drops per minute. At 15 drops per ml. We also have our antibiotic amoxicillin. The order is for 250 milligrams. We have our formulas. So the fluids that we're giving is going to be 150 mLs per hour times a 15 drop per ml drip rate, totaling 38 drops per minute. Our antibiotic is amoxicillin. Doctor ordered 250 milligrams to be given in a 100 ml bag over 15 minutes with a macro drip set of 15 drops per ml, totaling 100 drops per minute. We have our patient. Due to the film, we've already hung our hanger to prepare for the tubings. So first thing we're going to do is go ahead and get out our primary set. We are going to open it up here. This side, it needs to remain closed with the cap because it's going to be going on the patient. This side needs to be sterile, so we keep the cap on until we're ready to spike. We're going to start with spiking the fluid. We're going to remove the cap here, remove the cap here, insert into the fluid. We're priming the tubing, making sure that there's no air. We're going to slowly open. We don't want to introduce any air into our patient, so we want to make sure that the tubing's primed. We're going to go ahead and connect it on the lower end since we're hanging a piggyback. Our chamber is half full, it's closed. We're going to take the alcohol swab. We've verified our SITS rights. We've checked the MAR for the order. We've verified our SITS rights, right patient, right drug, right dose, right route, right documentation, right time. We're going to clean our patient's IV site with alcohol. Let it dry for 1 minute. 1 minute has passed. We're going to connect our fluid. We're gonna slowly open our chamber and we're gonna count the drops for 1 minute. One minute has passed for the purpose of this video. We have 38 drops per minute. Next, we're gonna go into our piggyback set. We wanna make sure that that's closed off. Next, we're gonna go into our piggyback set, which is our antibiotic. We verified the MAR. We've also triple checked with the patient to ensure they have no known drug allergies to the medication. We verified our SIDS rights, right patient, right drug, right dose, right route, right time, right documentation. And now we're gonna go into hanging our piggyback. We're gonna pull out our tubing. Again, we want to make sure our clamp is closed. We have our sterile end that's gonna be introduced into the medication bag and the adapter that's gonna go into our piggyback. So first things first, we're gonna remove the top from the bag, remove the sterile top. We're gonna spike the bag. We're gonna flip it over. We're gonna slowly open to prime the tubing to make sure there's no air. We don't want to introduce our patients to air and to avoid any embolisms. Gonna go ahead and close that once we've primed it and hang it. The IV medications need to be hung at least 30 inches above the patient's IV site for safety. Next, we're gonna clean the port that's attached to the primary tubing. Let that dry for 1 minute. One minute has passed. We're gonna slowly open our piggyback and we're gonna count for 1 minute. For the purpose of this video, 1 minute has passed. We've given 100 drops per minute. We want to ensure the patient's in a safe position, check the IV site, make sure there's no complaints of pain. We want to make sure the patient has a call light next to the patient. We also want to look at the site, make sure there is no signs of infection. We want to perform hand hygiene. Patients should be comfortable and being watched for any anaphylactic shock, any side effects to the medication that's being administered. Check for any redness, puffiness, itchiness at the site. Once we've cleaned the patient, kept them in a comfortable position with the call light near, we've cleaned up our stuff and we've performed hand hygiene. We want to stay close by to monitor and document our administration. All right.